Hi everyone, it's Dr. Gina Joe, or Dr. Gina Jefferson, Professor of Otolaryngology, Head and Neck Surgery. Third year medical students, it pains me greatly that I find the topic of this video even necessary. In listening to some of my friends and colleagues, we have discussed occasions where we've witnessed medical students displaying unprofessional behavior. Behavior so unprofessional, it lends itself to think, is this medical student capable of rising through the ranks of residency and performing well as a physician beyond? For example, it is completely inappropriate for a medical student to argue with a second-year resident over the task outlined by the chief resident for the day. Also unprofessional is to visit a consult patient independent of another resident or attending where a procedure is performed. This video is to remind you that medicine is indeed a team sport of graduated responsibility. Professionalism and humility are key. Tip number 1, professionalism entails respectful interaction with those you encounter and with whom you work. It does not involve yelling at or arguing with others. Remember, while you are in fact participating as a team member for the care of the patients, you do not know it all. This is why medicine is training that lasts for several years. Even beyond the 5 years of otolaryngology training, I cannot stress enough the importance of lifelong learning. We must continue to seek new knowledge, read, attend conferences, learn from our colleagues. All of this embodies professionalism. Tip number 2. This is simple. Medical students have no responsibility for patient care. Do not embark upon patient procedures without supervision. Medical liability rests on the shoulders of those of us with medical licenses. Residents and faculty alike, of course, appreciate the driven, self-directed medical student. This in no way means taking things into your own hands. Demonstrate your medical knowledge by presenting patients with a succinct and well-developed assessment and plan. For new patients, you can include a differential diagnosis and why the top of your differential is what it is. Tip number 3, humility is key. This is what allows us to recognize what we do not know. Humility motivates us to keep striving to improve our knowledge and our skill set so that we may best serve our patients. Medical students, may I suggest that now is the time to thoroughly enjoy the learning process. In due time, you will be the one responsible for the patient's care. If you find my tips helpful, share them with your friends and continue to follow me at Dr. Gina Joe on Instagram, YouTube, and Twitter.